So the reason I went into medicine really was I was very interested in sports medicine. I was an athlete growing up, going through high school and college, and at an early period decided that I wanted to get involved in injuries. Thought about physical therapy for a while, athletic training, and then kind of settled in on going through medical school and going into orthopedic surgery. My real goal is to help athletes and help athletic people return to their activities. Outside the office, I'm a dad and a husband, and I have 5 brothers. I have 2 little babies, a 3-year-old boy and a 3-week-old girl. So I got my hands full at home. I like to do outdoor things and just try to stay as active as possible. Originally, I'm from the Northeast Philadelphia area. My whole family still lives up there. My wife's from this area, and I did my residency here as well. My fellowship was in Cincinnati. But we decided to try Asheville, North Carolina for a couple of years, and decided we just really missed Orlando and the excitement and the weather and the medicine. So we decided to come back here. Leisure time, I mean, anytime I can spend outdoors is time well spent to me. So I like to be outdoors with my kids, and I like to play sports if it's possible. It's a little bit difficult right now, but anything outside. Playing basketball is what I did growing up and all through college, so if I ever get a chance to do that, I'll do it. And I love golf. I'm not good at it, but I love it. I really enjoy interacting with patients. It's nice to get to know people. You know, it's not many professions where you get to meet, 20 or 30 new people every day. I do like to, like I said, take people who are hurt or injured and get them back into their activities. And I definitely enjoy seeing people and interacting with them and hopefully making it better. Orlando Orthopaedic Center is where I've wanted to be since residency, and for a variety of reasons had to do some time in Asheville, but Orlando Orthopaedics really, in my mind, is the premier orthopedic group in this part of the state. Dr. Schwartzberg and Dr. Bruce and myself have sports medicine training, and we're real excited about the direction that our group is going in, and as well as the opportunities we have for our patients within the group, including our physical therapy, our MRI, and our bracing. We're just really, I'm very excited to be a part of Orlando Orthopaedics, and I can't wait to spend the rest of my career. One of the more common things I see in my practice is shoulder injuries, and shoulders can be, quite complicated really to figure out the exact pathology, but it ranges from labral tears to rotator cuff tears to just impingement. And I always like to try to get the full picture with shoulder injuries. Been trained really to recognize little nuances in the shoulder, and we hopefully treat the pathology. I think it's interesting to figure out what's going on in the shoulder, and I truly enjoy diagnosing shoulder injuries and treating them. And in general, surgery is always a last resort when it comes to shoulder injuries, or any injury for that matter, and the treatment always initially is conservative if possible. So only when people really have exhausted conservative management do we recommend surgery, and that's pretty much across the board in our practice. But we certainly, if surgery is needed, or if it's necessary, I think that Orlando Orthopaedics provides the best care and allowing people to return to their activities. Well, a first-time visit for a patient, I mean, they will always get to see an orthopedic surgeon, and we really pride ourselves on having the total package at Orlando Orthopaedics. We try to be seamless. We try to see people diagnose their problems and then be able to offer them a variety of choices for treatment, including bracing, physical therapy, MRIs if needed, medications. So we really do feel like we are giving people a one-stop shop to get their orthopedic needs taken care of.